Have you ever seen someone and they look at it and you see their finger, the finger is kind of like drooping like this? I'm going to move to the camera like this. And what happens is that some people, they jam their finger against the wall, against the door, against the car door, or just while they're wiping the table and they jam their finger accidentally, and they realize that now their fingertip just droops down and they cannot bring it up anymore. No matter how hard they try, it just stays down. And usually there's no pain or very minimal pain. And that's why most patients, most people who get this condition is called mallet finger. They ignore this for weeks, months, and even years. They think that it's okay, and that's when it becomes a surgical or surgery problem. The problem with mallet finger is that usually mallet finger, because there's no pain, right, or there's very little pain, it feels and looks minor, like you can just ignore it. Patients just also will tell me, then they will laugh. It's like, hey, you know what? You know, with my this mallet finger, when I wash my face, it jams into my nose. You know, because they can't straighten it, so it's permanently hooked, right? And then it just jams in their nose while they wash their face, and they think is that it's funny or it's not important. It looks minor, but it's really not that minor, because a mallet finger that's treated wrongly or ignored for too long can permanently deform your finger or your hand. Okay, so here's what you need to know, right? So my name is Nigel. I'm from Phoenix Rehab. I'm a hand occupational therapist. Today we're going to talk and discuss mallet finger. We're going to break it down, what it is, how it's treated, when surgery comes into the picture, when it's not, what most people get wrong, and that cost them from, instead of having non-required surgery to requiring corrective surgery. So the first part is that let's talk about mallet finger. So mallet finger happens when the tip of your finger, right, this tip here, droops down and you cannot bring it up anymore. It doesn't bring up like this and bring it up. Mallet finger just stays down like this. People will just see it like that all the time, right? And you cannot lift it up. No matter how you try, even if you use the other finger and bring it up like this, and then when you remove your finger, it will drop down again. It just hangs there. So what happens is that the extensor tendon, the tendon that runs on top of the finger, that keeps the finger straight when you extend your finger, has been torn or ruptured at the attachment point on top, right? The most common cause of mallet finger is actually a direct blow to the fingertip. Imagine like a basketball, the ball hits the finger, you know, pickleball, you actually hit yourself or you bump into somebody while playing pickleball or volleyball. Even when my funniest story or my saddest story, whichever one you look at it, one of my sports medicine doctors, he was just wiping table, right, and he was like rigorously wiping his table with a rag or a cloth, with a tablecloth, and he bumped his finger into the wall, and that's it. It wasn't like that. It's not like he jammed it in there. He actually just, and his tendon just ruptured, and he came to me like this, Nigel, help me, right? So even something as simple as tucking in bed sheet the wrong way, or when you play with somebody sports or games, and then your finger hook on their clothing and it moves, and they, right? I have another example as well. I just share with and this guy's a banker, and I think he was really bored or he's really annoyed with somebody in the meeting or whatever it is, and he was just bending his finger, and then he heard, and then he got the mallet finger as well on his little, in his pinky finger, and I still remember him very well. And he was like that also can. Yeah, it's like that also can. Wrong angle or right angle, right force, you can snap your extensor tendon for your finger, right? So the injury looks small, so people usually assume it'll be okay by itself because there's no pain, right? That particular assumption is where things would usually go wrong. So there's two types of mallet finger. Let's talk about section 2. Two types of tendon, two types of mallet fingers. One is a pure tendon mallet finger. One is a bony mallet finger. Okay, very similar but very different. Okay, so let's talk about the soft tissue mallet finger. This is purely tendon, right? This is where tendon tears away from the bone. There's no fracture involved, and then the same thing happens. There's a droop here at the finger, right? It's very straightforward, and most of the time, significant majority, it responds very well to conservative splinting treatment. Okay, so that's the easy one. The more challenging one is actually a bony mallet, also called an mallet avulsion fracture. So instead of just your tendon, snapping for those kind of traditional mallet cases, for bony mallet, there's a piece of bone that gets pulled along from the tip of the finger, and you won't feel it any differently. It looks the same actually. The droop is the same from outside, right? But when you check on the X-ray, the doctor can see, oh, a piece of the bone has shifted, right? Okay, so the most important thing that you must know is that a bony mallet is not always a surgical problem where you need to do surgery. Most bony mallet can be treated conservatively depending on the condition, how severe it is. Splinting usually can do. But the key variable is how big that bone mallet is, the bony fragment is, and whether the joint is stable or not. I'll talk about that later in section 3. Part 3 right now. So when the surgery is warranted, right? So surgery becomes a serious conversation in two particular situations in mallet fingers. Firstly, if the bone fragment is really large. So mathematically, roughly speaking, if that bony fragment is about 1/3 to half of the joint surface, that means it's like half of your joint size, right? The bony fragment of the bony mallet, the structural integrity of the joint is compromised. Okay, that's when the hand surgeon needs to assess, need to go in there to stabilize it with a pin or fixation or not. Second condition, if the distal joint, this joint is the distal joint at the very tip here, this is the distal joint, right? So this is the distal joint. If the distal joint is subluxing, then it's drooping down. It's sublux. So instead of being like this joint, the joint drops down a little bit. Can you see? Right? So that's a subluxation. That means the end bone of the finger is shifting out of the normal alignment. When the joint is no longer sitting where it should be, splinting alone not enough. That one you should really fix it with surgery. Okay? This is the hand surgeon's call, not my call, not something that I can speak about or confidently talking about. That the hand surgeon talk about that. Okay, so if you have a mallet finger or you know somebody with a mallet finger recently and you haven't done an X-ray, go see a hand surgeon and get it X-rayed. That's your first step. If you do not know any hand surgeons in Singapore, I'll be happy to introduce you to some of them that are really good and very experienced, right? Okay, don't self-manage, don't self-splint, don't self anything else. Do the X-ray first. We gotta rule out whether it's bony mallet or not. Okay, so for those who require surgery, it typically involves a small pin being inserted to hold the joint in position to help it heal better and keep it secure. Okay, it sounds kind of straightforward, right? And usually it is, but surgeries always have some risk. There's always some risk. The doctor can share with you more, such as the pin site infection, there will be complications, prolonged stiffness, irritation, and you still need hand occupational therapy. So, which brings me to what I want to be clear about. Whether your mallet finger is surgery or no surgery, right? Hand occupational therapy is part of the recovery process. Either way, cannot run one, must do one. Okay. Okay. Now let's move on to the next part. This is how us hand occupational therapists will treat mallet fingers. Okay. So for conservative treatment, in majority of the mallet cases, right, the gold standard is a custom mallet finger splint. Okay, this splint holds your DIP joint, this joint, slightly extension, hyperextension, right? Normally they talk about full extension, but I prefer slightly hyperextension to keep the tendons that are snapped to go back together again, so that the tendon can heal together. Especially for, I shared with you earlier, right? Mallet fingers is where the tendon snap. So you want to bring the hyperextension so that snapped end can come together to heal. And they will heal most of the time if you're early to the party, early from the injury, right? Okay? The rule that makes or breaks this healing. You must wear the splint 24 hours a day, 7 days a week, minimum 6 to 8 weeks. It does not come off. It doesn't matter whatever, it itchy or not. You want to shower, and if you, let's say my mallet finger is my middle finger, if I want to shower, I have to hold my finger like that to shower. If I want to get it wet. If I want to do anything, take out my splint and want to wash my splint, I might keep my finger like that. Because the moment the finger drops again, like this, you have re-injured the joining parts again. Then you start the entire healing process again. So you start the 6 to 12 weeks, 6 to 8 weeks again. So you must be very cognizant about it. So for patients who don't want to be troubled by this or find it very mafan, then go straight to surgery, then get it fixed from the get-go. But for those who want conservative, want to do splinting and willing to go through the process, splint on 6 to 8 weeks, 24 hours a day. Just one mistake restarts the entire healing process. But it's annoying lah, you know, maybe the 8th week, then you accidentally drop it again, then you start all over again another 8 weeks. That's 2 months, 2 months, so it can delay. And then the tendon can pull apart, and then you're back to day one. And we don't like it. I'm not being dramatic. It's just how our tendon heals, right? And the best biology of tendon healing. So, like I shared earlier, patients always want to remove the splint to wash the hand. Singapore so hot and humid, you're kind of sweaty inside. So you want to take it out and wash it, you want to check the finger. I understand, but if you want to take it out, support the mallet finger. This motion looks kind of weird, but this is how you support it. Seriously, or you put it on the table, you just rest it, okay? But the good news is that the joint below it, so this is the DIP, the distal joint. This joint remains free, so you can move this joint, right? And we can move all the other joints that's not affected, right? So we keep everything above the DIP, the affected DIP, free while the tip heals. Now let's talk about the next section, the next part, which is what are the splinting mistakes that you need to avoid with mallet finger. Okay, I've been seeing this a lot. Some of the patients are going to the drugstore, they're going to the pharmacy, they're going to buy their own generic splint. Okay, these splints have so many problems. Number one, they are not custom to your size. Asians not only have different size to the mass market one, but every single finger is not the same, right? So they just want to plug it in and then put it up, and then maybe they stuff like tissue paper at the bottom to make sure that it's hyperextended, or maybe they don't even know that it's hyperextension. So they could be wearing a splint, but the finger could be like this in the splint, or like this in the splint, and this doesn't help the mallet finger. With your mallet finger, you need a customized splint where you can bring your finger to slightly hyperextension. And it's not convenient or not always standard if you're going to stuff in tissue paper, because you are not measuring properly and you don't know at what point the tissue paper starts to sink in. You're getting support for the hyperextension for the tendon to heal. You know, so you don't use a generic pharmacy one. You need a custom one by one of the hand occupational therapists for your finger for that joint. That difference really worlds apart, right? And that's problem number one of splinting mistakes. Splinting mistake number two, people want to remove the splint to check the finger. I was joking just now, like they take the finger, they take the splint out, see whether okay or not. So sometimes they do that at week 8, week 9, where it's really almost there. Then they take it out, then I'm like, why? Just don't check. Sometimes they do the work of healing first. I will tell you when to check. There's ways to check it, but normally just conservatively, just hold it. 8 weeks, I'm being more conservative. I like you to wear the splint for at least 10-12 weeks, because sometimes tendon takes a longer time to heal. You know, that's splinting mistake number 2. Splinting mistake number 3. Some patients, they either get CM, they get bored of it, they get impatient, they stop wearing the splint because it feels better, it looks better. Oh, I'm okay, it's just a bit of a bend, I'm okay, just a bit of a bend. And it's not fully bent, so it's only half bent. Just because you feel better, that doesn't mean it's good enough, because let me explain this to you, okay? The front side of our hand is called a flexor, this part is called a flexor, and this part is called behind called an extensor part. So there's a balance, there's a very fine balance between our flexor muscles and tendon to the extensors that keep it straight. If you take it off early and then you say, oh, since there's a little bit bend on it, it's okay one. But to let you know, our flexors are really strong. So eventually, our flexors will pull down passively. You're not purposely trying to pull it down. The flexor will pull down to a full bend like this. And it will stay like that because our flexor tendon, flexor muscle are really strong. So you don't stop your splinting for mallet finger early just because you feel it's better. Let the hand OT, hand occupational therapist, check and confirm. Okay, splinting mistake number 4. If you're not protecting your finger, you're not wearing a splint when you sleep, right? Even though we move here, move there during the sleep, the splint has to stay on. Sometimes I get patients to use the Coban to keep the splint on because sometimes patients in the mirror, they just find it hot, they just take it and throw it away. Wake up next day, finger bent, don't know where's the splint. And it does happen because when we're unconscious or uncomfortable, we shift around, right? So securing even more during nighttime is very important. And splinting mistake number 5 is they wait too long or they ignore it too long to get assessed, to get treated. There's a window for conservative treatment for mallet fingers. 6 to 8 weeks of surgery from injury, right? Sorry, not just surgery. After 6 to 8 weeks, the tissue had begun to adapt to the droop position and the tendons start to retract backwards. So it's kind of hard for conservative splinting to work already. After 6 to 8 weeks, after more than 8 weeks, if you want to fix your mallet finger, it's typically with surgery because the tendon had retracted a little bit. Okay, so the question is that when should you see us? When should you see Phoenix Hand Occupational Therapy? When should you see one? Okay, you should come and see our hand occupational therapies if you have a fresh mallet finger, number 1. If you just had it recently, this week, last 1-2 weeks, come. Time is still on your side, just come to us, right? Or you have a bony mallet that's confirmed on x-ray, we'll work closely with your hand surgeon. Or you don't have a hand surgeon, I'll be happy to refer you to a good hand surgeon who can take care of your mallet finger, bony mallet finger. That's number 2. Number 3, if you had a mallet finger for more than 8 weeks and you haven't treated it, chronic mallet finger is harder to treat, but it's not hopeless. You come on in first, let us assess and see what's still possible. We probably have a call with the hand surgeon and then maybe refer you to them to see what can be done still. Maybe still can be done conservatively, but the hand surgeon and our hand occupational therapist need to assess first. Or number 4, you have surgery already and now the rehab phase, or you haven't done your rehab and you find your finger kind of stiff, Hand OT is essential to get your range of motion back, your power back, your function back. And lastly, when you choose an OT, if you are a parent and your child has had this injury, there's growth plates are nearby, growth plates are involved, and children and definitely need specialist attention. You cannot ignore one, right? So, to close off, so mallet fingers is one of those injuries that look simple but can get complicated real fast if it's mismanaged, mistreated, ignored, or treated by somebody who's not a hand therapist who doesn't know what to do and do it generically. The flip side, the upside of this is that when treated correctly, treated on time, most and majority of the patients get excellent outcomes without ever needing surgery, right? So if you're dealing with a mallet finger or you know someone who has a mallet finger issue, please don't wait. Come and book an assessment with us, with our hand occupation therapist in Phoenix Rehab. Okay, the link or the contact should be in the description below. So if this video has helped you, share it with someone who has jammed their finger and think it's nothing, and especially you can see that their fingers are kind of droopy, right? This way, right? It might save them from a lot of trouble, from surgery, or at least shorten their recovery period with certainty. So I'll see you in the next video. That's all I have for you today. Take care. Bye.